call to now we have Dr. Sheetal Brar, and she'll be talking on the enhanced monofocal isofocal technology. A very prolific surgeon, and a good news that she's now relocating to Chandigarh with her big sprawling center. So we all congratulate you, Sheetal, and good luck for your best wishes for your new upcoming center.
Thank you so much, sir, and good afternoon, everyone. I'll be talking about enhanced monofocal isofocal technology, which is the IsoPure enhanced monofocal lens from BBI. So while the traditional EDOF lenses were better off compared to the traditional multifocal lenses with regard to the side effects that they had, however, with time it was realized that even the EDOF lenses had certain side effects, but to a lesser level compared to the multifocals, and these were the loss of light, halos and glare, and loss of contrast as well. So this is where the role of modern enhanced monofocal IOLs kicks in, wherein they have limited the depth of focus to about 1.5 diopters or even lesser, which is given in the basically to provide functional intermediate vision without any loss of quality of vision. So basically these lenses have two aims. One is to give a post-op functional intermediate vision without any deterioration of the quality of vision. This is what these lenses promise. So I'm talking about the IsoPure enhanced monofocal lens from BVI, which I have been now using since quite some time. And basically this lens has a unique design. The design is a 4-closed haptic design with a posterior haptic angulation of 2 degrees. Now the overall diameter of these lenses is 11 millimeters. And you might wonder, the lens diameter is 11 millimeters, which is smaller compared to a traditional C-loop lens. So why? So if you look at the average capsular bag diameter after lens extraction, it is around 9.75 millimeters. And for a lens, for a diameter of the bag which is 9.75 mm, 11 mm lens would actually suffice. So a 4-closed haptic design of IsoPure in 11 mm actually provides 70% greater contact angle and also 4-point fixation compared to a 13 mm C-loop lens. So this is the advantage of this design, that it provides a better and a greater contact angle and also 4-point fixation, which eventually improves the capsular stability of the IOL in the capsular bag. So the IsoPure lens also comes in a preloaded and a manually loaded injection system. The preloaded one basically goes through a 2.8 millimeter incision, and the manual one can go through a 2.2 millimeter incision as well. Now the unique feature of this lens is the isofocal technology, which has been incorporated on its optic. And what this technology essentially is that they have incorporated negative spherical aberrations across the full diameter of the optic. So over the entire optic diameter, they have the incorporation of negative spherical aberrations, and also on both the anterior as well as the posterior optical surfaces. Now this actually makes the lens completely pupil independent, and what it also does is that these spherical aberrations are further adjusted according to the IOL power of the lens. So basically, if your cornea is a myopic cornea or a hyperopic cornea, we know that the spherical aberrations are going to be different. So the other lenses, what they do is that they incorporate a fixed amount of spherical aberrations to the lens. So that does not give you a consistent depth of focus post-op. However, with these lenses, because of the isofocal technology, every lens has a customized level of spherical aberrations according to which are customized according to the thickness of the lens as well as the curvature of the lens. Now, because of this, what you achieve is a good balance between the depth of focus and the quality of vision with isofocal compared to the other enhanced monofocal lenses, where this balance is a little dysregulated. So coming to my experience with the IsoPure lenses, I have implanted about 25 these lenses in 25 patients. 20 IOLs were implanted for 10 bilateral patients. The first eye was targeted for emetropia, or the first plus or minus whichever was least. The second eye was operated within 2 weeks, and the second eye was targeted at 0.25 to a maximum of 0.5 diopters, depending upon the first eye outcome and if the patient desired to read better. So this is just a short video to show the implantation of the IsoPure enhanced monofocal lens. So what I like to do is to basically do a wound directed implantation and not a wound assisted. And I take the cartridge well within the anterior chamber, and I ensure that the leading haptics go straight in the capsular bag. And when the trailing haptics are about to open, I just slightly lift my wrist, so automatically the trailing haptics go in the capsular bag. So with this technique, you don't have to do any kind of manipulation while implanting these lenses. And you can see the surface of the lens. It looks absolutely like a regular monofocal lens. There are no rings, no optical element which can be appreciated. So the results at 1 month post-op were the mean post-op UDBA was 6/6. The mean post-op CDBA was 6/5. The distance corrected intermediate vision at 66 centimeter was 0.14 logmar, which is around 7.5 to 6.9. At 40 centimeter, it was 6.9 to which is 6.9 or N8. The mean post-op SE was plus 0.12. And none of the patients complained of any halos or glares or starbursts at all. So reading addition in most of the cases was 1.5. For some it was 1.75 as well, and for some it was 1.25 diopters. And if you look at the internal MTF of the IsoPure lens, and I compared it with Technis 1 monofocal, you can see that average height of the MTF looks quite similar for the IsoPure compared to the Technis 1. And this is a subjective contrast sensitivity, photopic contrast sensitivity measured with CSV 1000, wherein you can see that the contrast sensitivity of IsoPure and the Technis 1 were fairly similar. You can see they are exactly similar for all spatial frequencies. And only at when the glare was increased, at maximum glare, there was a very slight drop in the contrast sensitivity at higher spatial frequencies. So these are excellent results showing that the lens gives excellent quality of vision post-op. So to conclude, the IsoPure enhanced monofocal lens, in my experience so far, provides excellent functional intermediate vision and also some amount of functional near vision, which of course, most of my cases, I like to do a 0.25 to 0.5 monovision as well. So it has reduced the need for reading glasses also for many of my patients. No drop in distance visual acuity, no halo, glare, or any kind of compromise on the quality of vision. Very high patient satisfaction, wherein all the patients scored 95 or higher on the satisfaction score. So this is basically the combination of the closed 4 haptic design that gives a very good stability, a glisten-free, high-quality material, and the isofocal technology on the optic in combination that seems to work very well and provides excellent quality of vision in most of the eyes. And when I say most of the eyes, it means that eyes with any axial length, myopic or hyperopic, irrespective of the axial length, as well as the pupil size. So thank you so much for the
Thanks, Sheetal, for that wonderful talk. Just a quick question. Meanwhile, I'll request Dr. Chaudhary, Dr. S.K. Chaudhary, and he'll be talking on my experience with Minivel Toric. So I think we have 3 talks left, and if I can request all the 3 speakers to just have their bullet points, because Dr. Mahipal sir is here and he'll be chairing the next session on refractive, so we just don't want to impinge on his session. So Sheetal, I think that's very nice, and I think with the isofocal technology, I think the intermediate vision would actually matter with the extremes of the refractive errors, where it would, the extreme of hyperopias and myopias, where this lens usually outscores the other modified monofocal IOLs.
Yes, because of the isofocal technology that is customized for the IOL power, the thickness of the lens and the curvature, so it is expected to give consistent results irrespective of the lens power. So whether you have a high myopic patient or a high hyperopic patient, you are going to get around 1 to 1.25 depth of focus on the big focus charting. So
thank you.